Good morning, everyone. Thanks for coming. It's a beautiful day outside, right? Finally, the sun is shining. It's not super windy, so it's kind of exciting to have our event. My name is Kathy Palm, and I am part of the Compassion Action Network board. So on behalf of all of us, we have name tags on. Thank you again for coming. Our topic today is homelessness in Anoka County, prevention and resources. And we have some great speakers and panelists here to be able to share information about homelessness and housing in Anoka County and also resources that are available. I'm going to go ahead and introduce our panelists in order. The first one is Jennifer Crotteau, lead program planner with Anoka County and the chair of Heading Home Anoka Housing Collaborative. So thanks for coming. She's going to share some information and data around housing and homelessness in Anoka County proper, and then some of the resources and grants that are available for assistance as well. And David Frei is here. He is the executive director of Family Promise. So we're excited to hear about Family Promise and some of the new things that are going on. And we have Heidi Geiss, and she is a homeless liaison for Anoka Hennepin School District. So she'll tell us a little bit about her role there and some of the things that they're doing at the school district. And then Sue Rosendahl is a licensed social worker with Salvation Army, and she's going to be sharing a little bit about their prevention programs as far as homelessness and in general what Salvation Army, what resources are available. So our mission with Compassion Action Network is to foster collaborative opportunities to creatively address community needs in Anoka County. So if there is a topic that you're interested in for future trainings, please let us know. We will have an evaluation towards the end of the training, and there's a spot on there to put a comment if you have something that you're interested in. We do about 2 different training events per year, so your input would be really appreciated. Just for some housekeeping, there is bathrooms kind of back around to the right here, so feel free to utilize those. And we will have question and answer towards the end after all of the panelists have spoken. But if you have something that's really, pertinent that you want to ask them, go ahead, and I think that would be fine too. And we're set to be here until 11:30. Please remember we also have resource tables in the back, so if you need to take some resources, feel free to go ahead and check that out and grab whatever you need before you leave. All right, so I'm going to go ahead and have Jennifer come on up. Okay, good. Thank you.
Hello, everybody. It's great to see everybody here today. Hopefully you can hear me. If someone can wave from the back. Okay, great. Microphones in general are not my friend, so if I start speaking and you can't hear me, please let me know. I'll try to do my best to position myself to where I can be heard. So thank you for coming, everyone, and I really appreciate Compassion Action Network having us here today, and we'll get started. So there's a lot of information that will be on the slides today. The information is meant to be looked at a later date as well, because we won't be touching on all of it today. Housing is complex. There's a lot to it. We have some housing resource folks here that can tell you that it takes quite a bit to really understand the landscape. And today is really meant to be an overview and just to highlight some of the activities going on with Anoka County, within Anoka County, and some ways to get connected to resources and to people that can help. And so if there's any questions after the meeting today, I do have a couple cards out there. My contact information should also be in the slide. Don't be a stranger. You can email me, call me, and just connect and say, I had a question about this. I'd like to learn more. Feel free to do that. You are very welcome to do that. So with that, I'll get started. Just a little bit about myself. I am Jennifer Crotteau, as Kathy has introduced. A little bit about my background is I've spent about close to 10 years managing subsidized housing with a number of layer of programs, mostly in Anoka County, but also in St. Paul. I also worked in housing within Anoka County in social services for about 4.5 years now. And prior to that, I also worked in Anoka and Dakota County in all financial programs except for family cash and refugee cash. So that's a little bit about my background. I also, a long, long time ago, taught English, high-risk English, and really loved that. And so a little bit of everything is in the work that I do. And so I appreciate your time, and we'll get started. Today, this might be a little small, but I'll just touch on it. We have a packed agenda, and I will try to stay on time. But we're going to talk about some key data that just gives us the scope of what homelessness may look like, how it may present, and just give us a little bit of information about our region. And where do people often that are experiencing homelessness, where do they present? Where do they touch us in our services, in our programs, in our communities? We'll also talk about the housing programs. Housing program is a loose term. A lot of things fit underneath that, but for today's conversation, we'll be talking about the department that I work in, which is the Community Social Services and Behavioral Health. Local homeless prevention aid. We'll touch on a new opportunity for funding that the county has, a little bit on economic assistance, and then we will touch on housing prevention and resources and our mighty housing help desk and everything that our housing help desk staff do. And then we'll talk a little bit about FHPAP, which is Family Homeless Prevention and Assistance Program. We will touch a little bit on heading home and talk about some additional resources. And if you do receive a copy of these slides, there will be links to take you into further information should you be interested in following up with some of the information today. Any questions before we get started? All right. So one of the things that falls under my purview and my role is the point in time. The point in time is an annual count that happens in the last Wednesday in January. HUD sets the date, we do not. And that helps to, we have community volunteers and providers and county staff and county contracted workers that are all working together, economic assistance workers, to identify households that are tend to be literally homeless or doubled up in Anoka County. And it's one day that that count happens. It happens after that day, but we're really looking for a snapshot in that period of time. We also at the same time do a housing inventory count, which is also a count of who's in shelter at that time. For this slide, we are just looking at the 2022 point in time count. We do not have the data cleaned up and deduplicated yet for the 2023, but I anticipate these numbers to go up quite a bit. That is the trend that we're seeing. And so you can see on this slide that Anoka County is in the gray color, and we had about 218 identified households, persons in that associate with Anoka County. Really, this is the narrowest of funnels. When we identify someone in coordinated entry, we really are identifying a household that is literally homeless or has had a lot of barriers because of how you need to get screened in order to get counted into the priority pool. But again, also the same thing applies to going out into the community and identifying people that you see and doing a survey. You're only getting a small amount of folks compared to probably the overall population, but we need to measure somehow. The other slide graph there, the pie chart, is individuals in poverty. And you can see poverty is defined a few different ways, but Anoka County has a fairly significant rate of poverty, and we're at 37% of in that region. And so if anybody is familiar with housing costs, it doesn't take too long to put the two things together where income streams and housing costs can result in households having housing instability in our county. Moving forward, this is also some extra data about the point in time count that I just referenced. And we have households that are screened. They have to have high barriers in order to be added to this priority pool for the suburban metro continuum of care region, and that's the 5 counties surrounding Hennepin and Ramsey. And you can see on the graph, that top gray line there, that we had about 140, 150 just in Q2 alone entering the priority pool. And you can see the numbers are trending upward, and I would anticipate that this would continue as well. Despite all of the efforts being done, there's just a high level of need. And then households housed through coordinated entry. So coordinated entry is a system to screen folks, to get them connected to housing opportunities and services. They could be supportive or long-term housing. It can look like a number of things. We're also seeing that not as many households are getting housed once they get onto the priority pool. And this is something that is not immediate housing. It's not a shelter. It's a list that people are part of, and someone could always come in with higher barriers and a higher score and kind of leapfrog in front of another household that's been there for a long time. Like many of our systems, it's not perfect, but it is there to address and support people that are experiencing homelessness, and it's one measure as well. Taking the next slide here, as my role in facilitating heading home Anoka Housing Collaborative and the Family Homeless Prevention and Assistance Program, I had the pleasure of working with an advisory group that's been created this last year. And one of the things that we did was a needs assessment that we need to do, looking at the balance and the health and the housing and the needs of the community as it pertains to our area and our needs. And we have to complete this a survey. We look at census data, we look at data from public assistance, public health. We look at data from every area that we could get our hands on. We looked at qualitative data from school districts. We looked at data from faith-based communities. We looked at it all as a whole to try to figure out what is the needs in our community. In addition to that, we did a survey as a collaborative with the other counties in the SMAC region. And we sent out a survey to providers and also to households. We sent 2 surveys. And I feel like this particular data that was drawn from that survey is a little bit helpful, because this particular one was asking providers, estimate the number of households your organized served during the last month who are facing housing instability or homelessness. And if you see at the bottom, there's an average number monthly that were served, a total number. And so we had a lot of providers, and the bulk of them were from Anoka County, and the responses. So you see that there's quite a bit of households being served on average by providers. Many serve many people, as you can see in that total number column. And the responses on the column on the right tells you how many providers, so this could be a shelter, this could be a mental health agency, it could be a clinic, that gave a response to that particular question. So if you do the math, it's quite a few households that are being served. What I also like about this is it really tells us the story about who is presenting to our providers in the community, if it's unaccompanied youth, if it's homeless families, if it's adults, and so on. The next slide is who is turned away, right? So we often measure who gets into a program and what their success rate is after they get into a program, but how often do we measure who gets turned away, who needed services, and the provider was at capacity, was not able to serve that household, was out of funding? This is a similar type of slide and information about the average number of households, and again, the bulk in Anoka County, most of the responses came from our county, were turned away. So average number, homeless unaccompanied youth, 6, total number 232 from 42 different responders, okay? And sometimes these could be the same people within an agency. So multiple persons within Anoka County might have provided this information. So there's the potential that there's a duplication of folks, but it just gives you a wider understanding of the number of households and individuals and youth that are presenting for assistance and aren't able to get that assistance. Just touch on this briefly. Anoka County is about the 7th falls in about the seventh spot in incomes, in the average median income. However, we also have higher living expenses. So it's a double-edged sword. We do have an okay income. We have some households, but we also have about 40% of households in Anoka County that really would struggle with the costs of a family with one child. If you look at the chart at the bottom, it really breaks down, the typical family, 2 adults, one working full-time, one part-time, one child, and the yearly cost of living and the hourly wage required and the costs of childcare, food, healthcare, housing, transportation, other, you name it. It would take 66,000 to support that household. And if you look at the graph above it, then that breaks down where people fall into the income brackets. And only, it's about 50-50 of who could afford that, right? And we're not even adding on more children or more costs and really taking into all of the expenses. We also have a high amount of people that are cost burdened in our county. And the cost burdened folks are just really having a hardship with paying their rent or their utilities or their mortgages and really struggling to get by. And so we often see people present with homelessness that are just one paycheck away from having an issue, or maybe they've accessed services one time and they've used that up and another thing happens and they're not able to move forward or retain their housing. So again, just some information there from the census. So where do people show? I'm sure you're here today, a lot of you, because people that are experiencing homelessness or housing instability often present to you, right? And you're working with them or you're hearing of households and whatever you do that are touched by this issue. Some of you may work very closely with folks, some of you may be a step removed, but it felt like it would be just beneficial to kind of talk a little bit about where we might identify folks, because we're not going to necessarily know in a room like this who is experiencing homelessness, right? Anybody could be. Anybody could be when you go shopping, when you go to the mall, when you go to a store. Anybody around you could be in that situation. You're not necessarily going to be able to pick someone out and know that they're, staying from friend to friend or household to household. You're not going to know a person's situation just by seeing how they present, okay? So the justice system, it's just a fact, and there's a lot of interesting data coming out, and I see we have Chelsea here that could probably attest to this as well, that people that are experiencing homelessness are more likely to interact with the justice system. They're also likely to have issues becoming housed once they come out, which then compounds that cycle. The healthcare system, there's a lot of data about ER visits, who's presenting there, and how can hospitals and such work with folks to get connected to healthcare, and how can we move the dial on that where people present in those systems. We have shelters and drop-in centers. We have Family Promise in Anoka County, Stepping Stone Shelter. We have a community social services hotel shelter that emerged during the pandemic. We have the Alexandra House, Hope for Youth Drop-In Center, Dwelling Place, and other little shelters or transitional housing. We have some gaps in our shelters for sure. And I'll leave that conversation to later in terms of just the volume of families presenting and the ability to house them temporarily in Anoka County. It's a large need and it's a large job. And it's not one person or one agency's job, it's a community job, right? And then we have schools. Heidi will talk about how people present there, public spaces. These are the folks that we might see. And we might say, oh, that person is struggling with their housing. They look like they may live outside. Transit shelters, libraries, gas stations, stores, hotels. Hotels, 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 hotels. A lot of households lose their housing. The only place that they can get housed is a short-term temporary stay. Maybe they stay there for a period of time. Their Social Security or the money runs out. They go to their car. They get paid again. They pay the hotel. And it is not really a situation where people can get traction to get out of that situation. How do you get money for your deposit? How do you get rent when you're paying everything to a hotel? How do you get stable in your life when you don't know for sure how every week of the month is going to look like for you? So, and vehicles, of course, and on the street or in encampments. Encampments happen in Anoka County as well. They're not necessarily on the news, but they happen here too. And our PATH folks that work with street outreach and our street outreach for youth would be able to attest to that. And then food shelves and faith-based community events. Huge need is being met. As Sue over there can say, that there is just a huge need that's being met by faith-based communities that they lift up and they help support households in a way that we don't measure necessarily at the county. I'm going to move forward from this. So another key fact before I move on from this is old data, but the state has stopped sending this. Unfortunately, the fellow that did great work with data at the state and was sending us this information is no longer there, and we have not gotten new data. But I can tell you consistently over the past several years, it's about the same. So I feel fairly comfortable sharing something from 2021 because I don't feel like the numbers have shifted. This is from Anoka County, our MAX's public assistance system. And what this is for people that present and need help with childcare assistance, food support, if they have a disabled basis for medical care, general assistance, MFib, all of the programs that you think of public programs being. About 20% of those households are living with family and friends due to economic hardship. 20%, 1/5. So that is, I think, just a really key indicator. And we can kind of glean that a lot of those households may be families just because of the programs that they're open to. But what happens is if you have an eviction, if you lose a job, if you have an event, you move into a household, maybe their household is at risk for losing their housing, right? But you don't have a lot of options to get back out, and trying to attain the income necessary to reestablish your housing, especially if you now have rental barriers, can be extremely tricky. So from that, I'm going to go to just an overview. How are we for time? Perfect, good. So as I was saying, no one necessarily owns homelessness, right? There's not one entity that is designated to address the entire problem, right? It's us as a continuum. All of the agencies, all of the providers, all of the faith-based groups, the county services, all the social workers, the waiver workers, people in the community, all of us are that continuum, all right? And so housing's bigger. No one owns all the housing, right? Every environment's a little bit unique. Anoka County's a little bit unique. We have a lot of houses and we have less rentals. We have high prices for rents. We have high eviction rates here. We have our own unique environment. We also have a limited number of subsidized housing and affordable housing opportunities. And that creates a little bit of our environment. So that's our environmental picture. Then we have the overall housing system. What exists, in the affordable housing spectrum? What assistances are there out there? Again, some of that the county touches, some of it does not. But there's an overall housing system. And then from there, on the left circle, you see CDA, which is the Community Development Agency within our county, and the Community Service Agency, which I am part of, and many of you here are part of. And so that's where we intersect with our programs, is sort of that middle shared space in that graphic. So I'll move forward. I like this slide. This came from my manager's presentation, and I really liked it because it kind of gave an overview of a continuum. And again, not all of these things are Anoka County per se. They may exist in Anoka County, or there may be something that we are helping to fund in some way. So there's a spectrum of the continuum of housing that reaches from homeless outreach, shelters, prevention services, what do we do to help people not become homeless, specialized housing for specialized populations, housing navigation, how do we help people navigate this, and then supportive housing options, how to a service called housing stabilization, and then we have the magical and wonderful vouchers and subsidies that we have, and those are life changers for a lot of folks. So if you take a look at each arrow, you see what we have going on for the county. So Guild is a partnership with Anoka County. Tim could tell you a little bit about that. Tim Carroll back in the corner there. But Guild helps outreach to folks that are literally experiencing homeless in the county, and they also connect with folks that may be experiencing mental illness within and are homeless within the county, or impacts of mental illness through a variety of programs that they offer. And so we do have folks that are going around in Anoka County trying to connect with individuals, and there's ways to send referrals, and I'll get to that in a little bit. We have Hope for Youth, who's now just become a FHPAP subgrantee, which I'm thrilled about. So we've added some capacity there. And then we have a little bit of a youth drop-in centers that YMCA manages on Wednesdays as well from their own funding. And then shelters. We have the Stepping Stone Shelter in Anoka County. Anoka County helps with the funding, with a housing support agreement there. Same thing with Hope Place, with transitional housing there for youth. We have the family shelters listed there as well, in our hotel shelter program as well. And then we have prevention programs, specialized programs as stated. The navigators is where, at the very bottom, that I want to point out, is where our housing help desk is listed, and that's a call line. And we'll be talking about that in a little bit, but that's really where housing navigation lives with Anoka County, is there. It also lives with our coordinated entry screeners for the Salvation Army and YMCA. And then services like mediation services that are often linked to helping people that are connected to the court system in some way, often to do with housing. And then we have a little bit of supportive housing, the old board and lodges, and the capacity is on the right there. And then there's a medical assistance benefit called Housing Stabilization Services for people that qualify. And then there's our wonderful voucher programs that our Housing Help Desk also facilitates, that we are able to help folks from time to time when we're able to service households with Section 8 housing choice vouchers or programs. All right, so these are some of the current initiatives on the left. There's been a recent reopening of a board and lodge that helps support people experiencing adult mental health, and potentially also substance use disorder at the same time. It is Mission Height Board and Lodge, and it's open and functioning. We're very excited to have that back. This used to be the VOA, which ended up going away for a short period of time, and the property has been remodeled, and they're looking for folks to work with. So there's more information about that as well. And then there's a program called Housing Support for Shelter. We touched on that. I'm very excited. The Family Homeless Prevention and Assistance Grant, which is a program that helps connect people that are at risk of experiencing homelessness or are currently homeless, with help with rent or deposit or short-term rental assistance and some case management services. We are asking for a significant funding increase. And to put this into perspective, our last 2-year grant amount was around $794,100, and we are now going to ask for $2.5 million, which means that we will have a lot more direct assistance, a lot more supportive services when Sue gets calls at the Salvation Army. Hopefully we're not out of funding in the first week, those types of things, because there's more funding and there's more help for folks available. So that is very exciting. We'll see what happens. We'll be sharing that information out. And then we have the CLI infrastructure grant that funds our wonderful housing help desk. We have the homeless assistant grant that helps with street outreach. So we're patching like a quilt, a lot of different grants, funding sources, mechanisms to be able to put together housing services in the county is essentially how that works. And then we have some new initiatives. So Heidi here and I've been working together on Homework Starts with Home and along with our advisory folks. And we submitted an application for a grant that would help school connected youth and families connect to subsidies and rental assistance. And our selected subgrantees for that program would be YMCA and the Salvation Army, should we be fortunate enough to get funded. And what's really excited about this program is that we would be working with 6 schools within Anoka Hennepin School District and really focusing on areas that really we can make a difference in and really impact the lives of those families and youth experiencing homelessness in those particular schools. But we also have a plan for anybody else within the Anoka portion of the district to be able to get referrals as well. We have asked for subsidies that would carry about 36 households through to get them to a permanent housing option at the end. And it's a 4-year grant period. So we're excited about that. Cross your fingers. Hope it happens. It would be great news if we could get this going. We'll hear about these at the end of June. And then we have the local homeless prevention aid to counties. I'll go to the next slide. But this is a statewide initiative where about $20 million was made available to all counties. They get a portion of it. Ours is around 1.987 million, which is not a small amount, to help support households, again, youth, school-connected folks experiencing homelessness or at risk of homelessness with their needs. And so right now there's a planning group looking at what to do with that funding as well. So lots of exciting information there. This is a slide that has a little bit more information about the housing program overview, the local homeless prevention aid. And again, this is a really unique program. It's from the Department of Revenue. And I don't think county programs are just typically not funded by the Department of Revenue. But there was a representative at the legislature that kind of wrote one in and kind of snuck it past, and it got some traction, and we all got funding. The funding is going to be based on how many households are experiencing homelessness in Anoka County in the school systems here. And so our funding's significant because the numbers are high. The individuals experiencing and impacted by homelessness in schools is very significant, and Heidi can talk about that a little bit more as well. But we have some funding, and it's very exciting. And there's some information about listed below about things that we can do with the funding to support these households. And this is just talking about our planning process. We've established a work group. We've participated, some of you folks have participated in listening sessions, maybe completed a survey to help us understand what the need is and what the interest is to use with these funds. And then the procurement process, the process of connecting the grant, the funding dollars with an agency or a service that will get the funding or the services out to the community will begin in June. So some of that will start happening. Always takes longer than you think, but we'll see what happens. All right, so let's talk about economic assistance. Many of you may be familiar with emergency assistance programs for adults and families. One's called EA, one's called EGA, not to be confused with economic assistance. We have lots of acronyms that overlap. It also has very specific guidelines. It's a public assistance benefit that is really designed to help a household with utilities, help with rent and deposit, help with, just getting a short-term emergency resolved so that they can either attain housing or stay housed. I'd like to point to a little bit of the need. If you look down at the bottom of the EGA information there, we did get some numbers for this, and the households receiving assistance and asking for assistance is really up. And last year, There was around $228,000 of issuances for EGA and around $623,571 for families. And averaged out for household, that's around $1,500 per household that received this assistance. So think of that, how many households were helped by that local economic assistance worker processing those applications, doing the work to help that household stay housed. But again, so many do not qualify for this program as well. So once again, we only can measure what is being done, not what is being turned away. So let's get to resources. What can we do about this, right? We know there's a problem. We know there's people in need of assistance and guidance and direction. I'd like to take a moment and talk about our housing help desk in Anoka County. And the housing help desk number, out on the table there's materials. I would just encourage you to take cards, take quite a few. I don't want to take them home with me. I've got quite a few, but they have the housing help desk number on that, and that number is anything that any provider or any person in the county could call to try to get connected to housing resources and information. Some of the duties of the housing help desk are there. They also coordinate our hotel shelter program. Our hotel shelter program, you could not call the housing help desk and say I need a shelter space, because that's really meant as an overflow for other shelters and other providers to refer directly to. So that housing help desk worker that answers that phone call is not going to be able to connect someone to a shelter, and we just don't have space. The shelter averages around 15 households per week that's being served in a hotel setting, with some light case management by Anoka County and the connected caseworkers. And then they facilitate emergency social service placements. Big piece is that they also help with mainstream vouchers and other voucher programs and facilitating those very important programs and connecting people to subsidies. And so again, that information is out on the table there. I'd encourage you to take one of each flyer and share with your organization. And the housing help desk has recently expanded. We have a couple of housing resource specialists, I see you, and we also have a lead worker, Stacey O'Donohue, does great work, and we have associated case aid, an outreach worker, and so our capacity is expanding. And then we have the Family Homeless Prevention and Assistance Program. I'm going to skip past this. We talked about it a little bit, but the roles and responsibilities and the work is listed there. Heading Home. Heading Home is a partnership agency of community providers, and it's a collaborative that works together within the community of nonprofits, agencies, county staff, interested individuals, persons with lived experience that pool together to tackle a number of things, either loosely or organized within the county throughout a planning cycle of 1 year. And so there's a lot of things that happen every year. There's events that may happen that are organized through a committee, but a lot of the work is done through the Heading Home Anoka Housing Collaborative. There's some information there on that. I'm the facilitator of that meeting at this point. We are in the process of electing a chair that hopefully will take on some of those things. But it's anybody that's interested in learning more about this, please contact me. It is a dual partnership. It's meant to be something for the people that attend and also for us as well. And it is a good space to meet like-minded folks and gain a lot of good resources. And if you're interested in doing something with your time, I can help you with that. So. And then we have some committees that are connected with that. And the advisory committee is a very important committee that helped us with planning for the grant funds. I'm gonna wrap up here in a minute and talk about additional resources because I am out of time. But there's some information here. Some of this information will also be on the paper slides in the back. But I want you to pay your attention to the Guild Services Path and Street Outreach, and there's a referral form. If you see someone that needs assistance and really want to connect them with someone to engage with them, then that might be an opportunity for that. So I encourage you to look into that as well. And there's also a program called Housing Stabilization Services. So if you know people that are open to medical assistance and have a disabling condition and need some help getting just traction and finding housing, there's information there as well. And then court, mediation, and restorative services is listed there as well. And some great resources are there if you would like to click on them as well. And with that, I will turn it over to David. Thank you.
So thanks everybody for being here today. Jennifer did a great job of being able to share the statistics and the broad landscape of homelessness in our community. And so the next three of us are going to drill down into certain specific areas there. My name is David Frei. I'm with Family Promise in Anoka County. Family Promise is an organization that we've been around for 13 years. Started as a network of local congregations who banded together to create a space and a response to family homelessness in our county. I started as a volunteer there. We have a number of people that have been there since even before I started as a volunteer, a whole row practically there. But I started as a volunteer there. I got roped into helping to set up at my local church, move a couple of walls that needed to get moved so that they could serve on that day, and that was back in 2010. And then, a little bit more volunteering here. And as volunteering opportunities often escalate, that happened. And so now I'm the executive director and have been for 7.5 years. But Family Promise is, oh, that's me. Sorry, my phone's ringing as I have the timer on it too. So. But Family Promise exists to help families in Anoka County that are experiencing housing insecurity. And while we work and we're thought of as a shelter, really our goal is to get people into that next stage after shelter, into an opportunity of housing stability, where they will have that opportunity to be permanent and stable there. But thinking a little bit about, I'll get into how we've changed over time shortly, but I want to put a little bit of a face to the numbers that Jennifer was sharing. And this gentleman up here is the face of homelessness. If you put homeless person into Google Images search, these are the two first images that popped up. And this is really a pretty adequate vision, actually, for a lot of our history in this country. Until in about 1980, fewer than 5% of the people experiencing homelessness in our country were families. The rest were individuals, so that could be youth, or in the most cases, it was individuals like this. More than half of the people experiencing homelessness in the 80s were single men. Way more than half. I don't remember what the number is off the top of my head, though. However, by the time we saw that housing crisis in the early 2000s, early to mid 2000s, the number of families as part of homelessness, people that were part of a family experiencing homelessness together, that had jumped to 40%. So a big change in just about a 20-year span, a 20 to 25-year span. We know that number is probably even higher today. There was a Wilder Foundation study that was done. This is from 2018. I don't have newer numbers yet, but that shows in Minnesota that youth, unaccompanied youth and children who are part of a family experiencing homelessness together make up almost half of the people experiencing homelessness in our community. So obviously the face of homelessness has changed over the years, but we haven't necessarily gone and changed how it is that we are responding to homelessness. We've generally made adjustments to what we have done before, which means that we're basing it on the understanding of how to work mostly with single men experiencing homelessness. Because the face of homelessness today looks a lot more like this. This may be the person that is behind you in the grocery store. It may be somebody who is on your kids' team at school, or it may be the person in the car in front of you in the pickup line. It's not the same sort of image that we have because homelessness has changed drastically over the time. I think that while it has changed over the decades, though, we haven't really changed our responses to match that change. And that's something that I'll go into in just a second. But first, I want to talk a little bit about what it is that makes family homelessness a little bit different and unique, and what some of those struggles are. One of the things that we've seen with Family Promise is that We often see families with limited income that are coming in, and there's one little thing that might cause them to start to destabilize, and then it's like a domino effect. Everything collapses as one little thing that changed when they're living on the edge for a long time. For instance, we may see a family that has been paying half or a little bit more than half of their income toward rental, toward a lease. They've been making a go of that maybe for 3 or 4 years, but now that building is being sold. So they have to leave. They have a good rental history. They weren't evicted. But the problem is no renter is going to take them if they're going to be paying more than a third of their income. They have proof that they can do better, that they can make a go of it on half, but they still can't get any housing. So just for the fact that a building sold, nothing else in their background, that family could end up experiencing homelessness. When we think about the places where struggle starts to occur, if we think about it as like a four-legged stool, especially in the suburbs for families, there are kind of 4 areas that we see when one of these starts to fail, everything else can start to collapse pretty quickly. So those areas: transportation, housing, work. We can add income there too, because sometimes people are receiving disability income or something like that. And childcare. So for an example, what we might see is, say for instance, you have a kid who is 4 years old, and that kid is in childcare, and RSV is going around at that daycare, and your child gets it and ends up being out of daycare for a week, and you don't have a backup, so that means that you're out of work for a week. That's 1/4 of all of your income for that month is gone. Now, say for instance that kid gets back and it gets compounded, the norovirus is going around later in that month, you miss another 4 days. Now you have lost almost a third of your income for that month. So the way that collapses then is that now you're struggling to make payments on everything else. Maybe your car needs a repair, you can't cover that, you lose more work pretty soon. You're calling Family Promise because you are struggling and you're right on the edge of losing it all. There are a few of the pieces that make family homelessness especially different. With kids involved, there's a higher feeling of shame, and people are more likely to try to keep the problem hidden. And there's also a recognition, a lack of recognition sometimes with families that what they are experiencing is in fact homelessness. Maybe because they're staying in the basement of a friend's house or something. Maybe because they don't feel like they look like that image I was showing earlier of that single white male who is experiencing homelessness that was in our mind from back in the 30s and 40s when our responses started. So thinking about those differences and those changes and the way that our response is based off of that individual, and we just kind of adjusted over the years, we feel like it's time to rethink how we respond to homelessness in general, what models we use, and how we do it. And so at Family Promise, we are continuing to focus on that same mission, but broaden out how it is that we're doing that. We've already added prevention and stabilization services, the idea of keeping people out of shelter in the first place. And once they have worked through one of either our prevention or our shelter programs, to keep them from needing that kind of service again. Because that problem of being such on a narrow, thin path with stability, it's important for us to work with them. But we have some places that we want to go that really drastically change how we will be responding to homelessness too, with some new ideas. But first, just for a quick overview, in the past, we were a network of local congregations that provided overnight shelter and hospitality and food for families. For a week at a time, a church would take the families overnight, and then the families would come back to our day center in Ramsey, where they would be able to, the kids would get on the bus to go to school, thanks to the McKinney-Vento, which we'll hear about shortly, and work with our case managers and get their services at the day center. So they're moving every day and moving every week. Now we are using the extended stay hotel model because thanks to COVID, we had to stop that process of our shelter model that way. But we are looking at our next stage, which is with a campus that will allow us to have a permanent shelter and an accessible service center in the heart of the community. We recently were able to purchase some property and really excited about the opportunity here. We are starting the remodel project on our service center and offices and also working toward what will become a new building. So right here, you'll see a map of the property that we were able to buy on and just off of Coon Rapids Boulevard. It is two pieces of property, a commercial property and a residential property. And this division helps us in a few ways. One is that it gets around a lot of zoning issues. Two is it helps with future funding and flexibility options. But number three that we're really excited about is that it allows us to develop a way to serve the families that meets their needs and centers on the children themselves. So while we'll be separating our services and the housing, that means that the housing is going to look a lot more like that we're planning to build is going to look a lot more like an apartment. And the kids, we're hoping, won't even necessarily recognize that their family is experiencing homelessness or that they're in a shelter program, trying to avoid that trauma. So we are working toward the next phase of this after we get finished with our building with the remodel of our service center is that we will be working to build the first phase of the residential one that would be 6 to 9 units that would be micro apartments, fully serviceable and hopefully adequate for the families to live on their own and to be themselves in that way. Coon Rapids Boulevard is the angle thing that's there just off of 610 if you're looking for the spot. I talked a little bit here about why a campus, but the main thing is right here down at the bottom. We want to center this on the experience of the children because they're what really makes family homelessness unique. And they are the place. That same Wilder research study that we looked at before found that over a third of the people who experience homelessness in Minnesota as adults first experienced it as children. We want to help to reduce the trauma and the times when families are struggling and the trauma that causes. So a few of the ways that you can help are on the screen here. You could talk to me at the table afterwards. Abler, a senator for a lot of you, is on the committee for one of those. If you have the ability to look that up, look up HF 444, find out what it's about, but that will include a lot of the money that all of us could be using to make a big dent in homelessness and could really help us get that phase, that next phase of our building done. So thanks for the opportunity to be here today. And like I said, I'll answer questions afterwards. Thanks.
Hello, my name is Heidi Geiss, and I am the homeless liaison for the Anoka Hennepin School District. Prior to taking this position very recently, I was the homeless lead in one of our high schools, Blaine High School, for about 8 years. So I come to this with a lot of background in McKinney-Vento law and kind of how homelessness affects our students at a real level in our schools. So today I'm going to talk to you a little bit about what McKinney-Vento is and kind of how we as a school district are working to support those students and things in our building. So McKinney-Vento it's a federal law. And essentially what it does is it enables us as a school, and it actually empowers us as a school to make sure that we're meeting and reducing barriers for our students experiencing homelessness. We have to reach out, we have to help find and connect those families and then work with them to make sure that those students can use school as a stable environment, even though outside of school might be a little more unstable for them. The definition of homelessness by McKinney-Vento kind of falls into 4 buckets. Shelter programs, so anything that's like domestic violence, a shelter, a homeless shelter, transitional housing, any of those kind of more traditional things you've heard of, those qualify. Staying in a hotel or a motel or other kind of place like that where they're paying, and it doesn't matter who's paying for that. So if the county has stepped in and said you're part of our hotel shelter program, that still falls in both of those buckets. Couch hopping, which is by far the most common thing that we see in the school district and the biggest barrier to us identifying families, because as both speakers have said before me, a lot of families don't identify as homelessness, even though they are experiencing a vast amount of housing instability. And so really getting those connections with those families and those students is vital so that we can provide these support services. And then unsheltered. We also do have a number of families, or more accurately, a lot of unaccompanied youth who are unsheltered and are staying in things like a park or a car or things like that while they're trying to kind of make ends meet. Also, with all of those things, even if a family is staying someplace, that residence needs to be fixed, regular, and adequate. So we also experience in our district a lot of families who they might be able to pay their rent, but for whatever reason, they don't have heat, they don't have water, or the landlord hasn't done necessary repairs, an appliance hasn't been working like a refrigerator or a stove. All of those things factor into that adequate kind of standpoint. Also, if we have families that are doing shared housing, even though they all might be contributing to that rent, there's 10 kids and 4 parents all living in a 2-bedroom apartment, that is not adequate. And so under McKinney-Vento, that family too would qualify for our support and services. So McKinney-Vento provides these kind of things for students. Most importantly is they get to remain in their school of origin. It's a family or student decision. So if a family was living in Anoka County, they lost their housing and they're staying with an aunt and uncle in Minneapolis, their family can choose to enroll their students in that school in Minneapolis, or they can remain at their school of origin. And again, it's about reinforcing that family stability. They're also entitled to transportation paid for by their district. So whether it's Anoka Hennepin School District or it's Minneapolis School District, wherever that student needs to go, we are obligated to provide that transportation for them. Within our district, it can look very different. We have buses, we have what we call type 3 transportation as well. We contract with other transportation companies who then provide kind of one-on-one transportation for our students that are experiencing homelessness. Immediate enrollment. So say an unaccompanied youth, this comes up frequently, an unaccompanied youth was living here and now is living somewhere else and they choose to go to that school for whatever reason, we have to immediately enroll that student, regardless of whether we can get their transcripts or their immunization records. We do not need parental permission. We need to enroll them and get them started because, again, the underpinning of this whole law is to make sure school is stable for them. Access to specialty programs, that can be sports, that can be activities, and again, working with transportation to provide that extra transportation so that they can participate, eliminating fees and other barriers. We work really closely with our high school athletes who need to get a physical, right? Coordinating that effort to get them that sports physical so that they can prevent or they can participate in all of those activities. And essentially just removing all barriers and access. So if there's a challenge with a student being able to participate in something, a family accessing something, it's our job at the district to make sure we are working around those barriers and eliminating them. And then they're automatically enrolled for free school meals, which until next year, which graciously everyone is going to be eligible for free school meals. This was a huge win for our families, right? Because we could guarantee those 2 meals a day. Why does this matter? Why is that school stability like such an important factor? Chronic absences, delayed enrollment, high mobility, lack of transportation. 41.9% of our students don't or have chronic absences that are experiencing homelessness. Those absences lead to a lower graduation rate and then also access to kind of post-secondary things. And I think anyone who's worked in education or understands that accessing things post-secondary past your high school diploma is what helps kind of break those cycles of poverty, right? So it's so important that we get in early, we improve that attendance, we improve that graduation rate, and we help facilitate our students going on to do something, be that college, internships, whatever it is they need to do, but they have the tools to do that. One of the other really cool parts about the McKinney-Vento law is there's a form called the FAFSA, FAFSA. And so it is what is required to fill out in order for you to attend a post-secondary educational institution. And students who have experienced homelessness are able to check a box, and that helps get them additional resources and grants to get them into schools and help them follow that path. For our unaccompanied youth, so those students who have no adults in their life, it helps especially because they're not required then to find their parents' financial data, which might not be accessible to them to be able to do that. So then they're able to enroll in college and do those kind of things. So it's vitally important that we're identifying our students. And this is our how I can help, but I want to back up just a little bit and say that a real function of our office, the Hope Office at the school district, is really helping to identify and find those families. Every school district is required to have a homeless liaison. In our district, I hold that role, but then we also have social workers and leads in each of our buildings that are working to identify families as well. I think then ask for this group too, and there's information back there if you know of families, because again, going back to what's already been shared, there's a huge stigma around this, and so we really want families to come forward so we can help offer some supports. Our office works very closely with all the other agencies up here, and it's a team effort to kind of wrap around families and make sure we're getting the supports that they need to them. And so identifying those students and families is really, really important. How you can help, advocating. I guess that was kind of it right there, right? Advocating for your families, for your students. If you're in a school, kind of being aware and having your kind of radar up about what a student and a family is going through, and reaching out to your social workers in the building to kind of make those connections. There's some posters back there. If there's places that you would like to post those that tell parents what their rights are and give them numbers to call and reach out, please feel free to take those as well. Our office takes donations of school supplies, new school supplies, hygiene items, things like that, that then we distribute to students and families that either come into the Hope office or more frequently through our social workers that are already in the building. My contact information is on here. And then for general, more information, because I think there's a lot of really good research and information and advocacy out there. There's 4 resources up here. When you get these slides, all of these are links that you can click on that'll give you more information about the law, about how you can help, and all of those other kind of pieces. Thank you for having me.
Let's see. Hello, I'm Sue from the Salvation Army, and we've been in Anoka County for 25 years or more. We were in Coon Rapids or Anoka for a while under Jim Abler. He was our landlord for a while, so he helped us get in. I know you mentioned him, so I'll give him a little kudos here too. And then Coon Rapids for a really long time, and now we are in Blaine, the Blaine Human Service Center building on 89th, which we love, and we hope we just stay there. So I'm going to talk about a few things. I will try not to get too in the weeds because I can, and I won't, but I'll try not to. Some of the things you've already heard from the previous speakers, especially Jennifer, because I'll probably touch on some of the things that we do, the things that she mentioned. So here we are. First thing will be coordinated entry, and this is where I won't go in the weeds, but just wanted to kind of mention, I don't know what my next slide is, but I'll go back. So coordinated entry, just kind of briefly, is, it's an initiative through HUD, and it really is our whole country. So it's kind of the whole country has started this program, and back in around 2014 or so. And it's just a different response. I kind of called it response to homelessness, just a little bit different than how it was, because it wasn't working before, and a lot of times it's not working after, but at least it's more systematic. And we kind of do things the same throughout the country, but we're divided, every state does it different, and then counties too. So when we talk about coordinated entry in Anoka County, if you're in Hennepin and Minneapolis, Hennepin and Ramsey, it's different, coordinated entry, but it's very different. And so for Anoka County, that's that word SMAC that you heard Jennifer say. It's in my office, I have a visual so I can show families I'm working with. It's like Hennepin and Ramsey, and then the 5 counties that's almost horseshoe, it kind of almost a circle. Anoka, Washington, Dakota. I always say it different. I say Anoka, I say it differently to every client. So I'm like, but it's these 5 counties. I'm used to rattling it off, but I want them to understand they're in a system of 5 counties that are all suburbs, and they could get possibly housed in any one of those communities, not just Anoka County. They all receive the same assessment. And I'll talk to you about that assessment, and it's really, the one thing about coordinated entry, since we started doing this back in like 2014, we've really changed it a lot. So some people who knew it back then don't even see it the same anymore. It's really different, and it's always being redesigned. We're in a committee right now that's really even changing it to be more client-focused and more effective. So if I'm here in a couple years from now, it may just really look a little bit different. So, but right now, how we have a step 1, step 2, really pretty basic titles for that, where we can assess people. For a long time, it was just straight to step 2, and we missed a lot of people who are doubled up. And we've been talking about that all morning. All the homelessness in Anoka County that sometimes gets overlooked is the families who are just couch hopping. It's called couch hopping or doubled up, staying with family and friends. And so the step 1 is really anybody who's experiencing homelessness. They aren't eligible for step 2. But we don't tell them that. We don't make a big deal about what step they're doing. We just want them to know they're in this coordinated entry system, hopefully to help them get housed. And the step one is really great because we can kind of quickly talk about how can you end up not in your car or a shelter or something. So that's really what that step is. And we can do an assessment. Okay, I'll go back. We can do the assessment. And basically, the greatest thing that's changed recently is, Jennifer did mention in the slide, housing stabilization. So really every one of those families, singles, families that we do coordinated entry with, step one, we then talk about how can we get them a housing stabilization worker. And they have to have a disability, could be very loose mental health, physical, and I make sure they know it doesn't mean you're collecting SSI or something. I mean, you could just have like post-traumatic stress, anxiety, depression that you have seen a therapist or something for, and that would count. And so if they have a homeless, have a disability, and get medical assistance, that's the third part of that really have to have those three, then we can actually get them a worker. And to be honest, we've seen people get housed. I probably wouldn't believe in it as much, because at first I was skeptical, but we have seen people get housed with that worker, like they can have a worker just working directly with them, because we can't do that. We don't have time for that. It's just not our role, really. So that step one is really important, and it also makes people who've been homeless a long time, doubling up, makes them feel like we are hearing their voice, that they are homeless. Step two is the real more chronic homeless. These are people who are literally homeless. You can see they're outside their car, they're in shelters, they've been fleeing domestic violence. That's just, even if someone's fleeing domestic violence and it's been short-lived, I mean, just recent, they could get a step two assessment, because that's such an important, we want to really listen to those women, to hear their voices in homelessness. So this assessment for, it takes a while. We do it either with people in person, we can do it over the phone, we could even meet with them in a different place if they are afraid to go out, come into our office, whatever. We try to meet their needs where they're at and do this assessment. And we don't tell them, we don't use big words, we just kind of freely do the whole conversation and get their information on a database. The goal is to match these families and single individuals with a housing program out in these 5 counties. So sometimes I'll say, there's not a lot of housing, more homeless individuals than housing. So we always make sure we mention, be looking for your own place. I know they all are, and we'll support them in any way we can through all of the county and the Salvation Army. But if they keep updating the coordinated entry, many people do get housed, and sometimes coordinated entry really gets a little bit of negative, because we see so many people and not enough getting housed that we really can be discouraged by it. And we wouldn't be sitting at those meetings monthly, sometimes weekly, if we didn't see people get housed. So it does work. That's that part. Yeah, the step two, it's deeper, it's a deeper dive. And the one thing about coordinated entry, it really helps start people's story about homelessness. So if they end up at Family Promise, they're not they're reliving their whole story. Family Promise can look at the coordinated entry and see some of the history, so people aren't constantly sharing information that they're really, frankly, sick of sharing. I will end that coordinated entry. I could go for a long time, but we can do questions later. Just a brief little tidbit about Salvation Army. We have a food shelf, and we have some volunteers in the back row that are our food shelf. They'll actually be there this afternoon. And so we get a lot of our volunteers from St. Tim's, so we really appreciate St. Tim's stepping up and handing their volunteers to us who work in our food shelf. We do clothes vouchers and transportation. We kind of earmark a lot of our transportation to the homeless individuals we're working with, because we realize they are moving around a lot, sleeping in their cars, and so we try to earmark our transportation to those individuals. We do work with bridging. So my next part will just be a little bit of dive into FHPP. It was really mentioned by Jennifer quite a bit, and that is the funding that's exciting, and it helps prevent homelessness. We have prevention money as well as rapid rehousing money. Prevention is really those individuals that we keep talking about that make up most of our homelessness in Anoka County that they're couch hopping, and we don't want couch hopping and people who have on the brink, like David said, those 4 stools on that table, one thing gets knocked out and they could be behind on their rent and facing an eviction. It doesn't take a lot when you're a single mom working hard to make it, and something, I like that table example, because something happens and they're behind on rent and facing an eviction. So this prevention money, it doesn't have a lot of guidelines. We do something called a prevention tool. They have to fit the poverty guideline. And we just love that this funding came with this tool, this wonderful tool. Before the tool, it's called the Minnesota Prevention Tool. And the great thing about it, I wanted to add here, is because we don't, at the Salvation Army, we don't have to, just the 2 of us who are doing these tools, make decisions based on our emotions that day, or who do we like, who cried the loudest, or who sang our praises, because that's how we used to do it, and it didn't feel really well. It didn't feel very good to think, did we make a mistake? Did I get my emotions caught in that? Which I probably did. The tool is a great, the state made it, and we just love it. It helps to, this money wants to help people with the highest barriers. It's not the easiest people. It's not the people that we don't, even on paper, we could say, they're not going to, I don't know how they're going to make it, because they don't have income and they have kids. But you know what? That's not our job. I always say it's not our job to be the judge and jury on who's going to make it. The tool finds people with the highest barriers, and we try to house them or prevent them from being homeless. It's a model that's called Housing First. And same thing at first, when there's some parts of it I can't quite wrap my head around, but when it really comes to this, I do, because I feel like we have a lot of our moms we're working with they have a lot of strengths, and they can make it even on paper. It doesn't look like they can, but they do, and it's a gift. I feel like a blessing that we at the Salvation Army get to see that. You can see people. So I'm going to quickly go on. I could talk forever about rapid rehousing, and I didn't even touch on that, but that's helping people who are maybe out of shelters, Family Promise, and we connect a lot, saying you can help them with part of it, help with the rest. So, and we are excited. There's a lot more funding coming with FHPP. We didn't talk about that today, but that you'll hear about on the news. But I think that's probably it. I think I'll just stop there, because I could go on and on, so I won't. Thank you.